So yeah, good evening. I'm Ahmed Kishin Ali, a your student nurse. So for today's video, I'll demonstrate how to assess a patient's nose, mouth, throat, and of course the sinus. So for the equipment, we need a pen light, a hand sanitizer, a tongue depressor or tongue blade, a small gauzy pad, and of course the gloves. Okay, the first step we must to do is to identify our client to ensure that we are dealing with the right client. And secondly, we must obtain nursing history and do a general survey prior to procedure. And lastly, if there are any curtains, doors in the room, they must be closed to maintain the privacy. So now I'm going to introduce myself to the clients. Hello ma'am, good evening. I am your student nurse for today and my name is Ahmed Kishin Aliapan. So ma'am, can you confirm your name and age?
Sure. I'm Narjina Abdulkader and 20 years old.
Oh, 20 years old. So ma'am, I'm gonna start with 2 questions.
Sure.
So any problem with your nose? Like frequent cold sinus infections?
No?
Oh, very good. That's good. So any problem with your teeth or mouth?
No?
Okay, thank you ma'am. So after that, we must explain the procedure to our client. So ma'am, I'm going to examine your mouth, nose, throat, and sinus. So the purpose of this assessment is to verify whether there is a problem or not at all. So rest assured, ma'am, all the documents, findings between you and me are completely confidential po.
Okay po, sir.
Okay, thank you po. So before we assess the patient, we must sanitize the hand and of course we must wearing the gloves. So now we're going to the first part of assessment, which is inspection. So we need to inspect open and closed mouth for the symmetry and alignment. So ma'am, if I'm going to say open your mouth, you should open your mouth. If I say close your mouth, you should close your mouth.
Okay po.
So ma'am, can you open your mouth? Close your mouth. So open your mouth, ma'am. So close your mouth. I notice it's all symmetry. So now we need to palpate and inspect the lips for the color and consistency. So ma'am, I'm going to palpate your lips. So it's okay with you ma'am if I touch your lips?
Okay.
So thank you ma'am. So I'm going to palpate your lips. Okay, up. Okay, thank you ma'am. So now we need to inspect and palpate the vocal mucosa for the color and landmark. So, ma'am, I'm going to inspect inside your mouth, and of course, I'm be using an equipment called pen light. So, ma'am, can you open your mouth? Okay. So, that. Okay. Thank you, ma'am. So now we need to retract the lips of our clients to inspect and palpate the gums for color and consistency. So now I'm going to palpate and inspect your gum, ma'am. It's okay with you if I touch your gum?
Sure.
Okay, thank you, ma'am. So, open your mouth. Sa kabila. Okay. See? So now we are going to palpate and inspect the teeth number, the position, and of course the condition, and lastly the color of the teeth. So ma'am, I'm going to touch your teeth. It's okay with you to check the position and condition of your teeth, ma'am.
Sure.
So ma'am, I'm going to start, ha. So can you open your mouth again, ma'am? So I'm going to touch your teeth, ma'am, ha. So sa taas. So sa kabila. Taas. Okay. So now we need to produce the tongue for number, movement, and color. So ma'am, can you reveal your tongue? So can you raise your tongue, ma'am? Okay, downwards po. Side po, ma'am, again. Another side to the left. So thank you, ma'am. So now we need to inspect the ventral surface of the tongue and the mouth floor for the color and landmarks. So ma'am, I'm going to inspect your ventral surface, and I'll be using this equipment called tongue depressor.
Sure po.
So ma'am, can you open your mouth and reveal your tongue for me? And then open your tongue and say ma'am. Say Open your tongue. Okay. Okay, thank you po, ma'am. Sorry, ma'am. So thank you. So now we need to inspect the soft palate and the color, of course, color consistency. So ma'am, open your mouth again and say if I put this tongue depressor on your tongue. So reveal your tongue, ma'am. So and say Say Okay, thank you, ma'am. So now we need to inspect the appearance for the colors and landmarks. So ma'am, can you open your mouth and reveal your tongue, ma'am? And I'm going to press your tongue using our tongue depressor again and say ma'am. So now we need to observe the external nose or the appearance, shape, and nariz. But before that, we need to remove our gloves because we put this on inside the mouth of our client. We will be wearing another glove for this. Now we must observe the client's nose. So I'm going to observe your nose, ma'am. I'm going to inspect it. So it's all symmetry, the shape, your nose, the appearance of your nose. So yeah. So now we need to inspect the internal nose for the appearance and landmarks. So we will be using the equipment called pen light. So ma'am, I'm going to inspect your internal nose. So can you tilt your head, ma'am, up? So up, ma'am. So I'm going to oh. Okay. Okay. Thank you, ma'am. So next, for assessment, we need to assess the functions of the nose for patency. So, ma'am, I'm going to touch your one nose, like this, and if I say breathe, you need to breathe. So next, I'm going like that. Can I start?
Sure.
So I'm going to put my another gun. So breathe, inhale, exhale. So okay, inhale, exhale. Okay. Thank you, ma'am. So now I'm going to palpate the nose for firmness. So ma'am, I'm going to palpate your nose. So ma'am, I'm going to start. Okay, thank you, ma'am. So next, I'm going to palpate the sinuses, frontal and maxillary for tenderness. So yeah. So ma'am, I'm going to touch your face. It's okay with you, ma'am?
Okay.
So I'm going to palpate, ma'am. I'm going to start here. Going there. Yeah, thank you, ma'am. So now we need to percuss the sinuses for resonance. So ma'am, I'm going to touch your forehead po.
Sure.
Okay. Now we're going to perform the Rumberge test. So for this Rumberge test, we need to ask the client to stand up, and we need to stay behind them for in case they out of balance, we can able to catch them. So ma'am, can you stand po, ma'am, because we are doing the Rumberge test po. Test po. So please right, ma'am. So yeah. So stand straight, ma'am. Okay, and do. We can see. So, ma'am. So 2 hands po. So you stand straight, and yeah. So hold this for 30 seconds po, ma'am. So yeah, it's all good. The posture, no swaying. So yeah. So the eyes po is open. Open po yung eyes. So yeah. So let's assume it's done. So next, relax for at least 10 seconds, and we do the same procedure, but the eyes are closed. Can you raise your hand, ma'am? So close your eyes and relax. Okay, I can see, I mean, I can notice there are no swaying, and yeah, it's pretty normal. So can you sit, ma'am, again to your place? Thank you, ma'am. So that is the last part of our assessment. So after that, we must return all the equipments we use, the gloves, and of course the tank to pressure. We must throw it to the can where it belongs. So yeah. So after that, we need to sanitize our hands. So for the documents, today I examined Ma'am Norgina, 20 years old, female. So for inspection, I didn't notice any sinuses or any abnormalities on his nose, throat, and sinuses. So for the assessment, it's all normal. So yeah, that's it. So ma'am, thank you po. The results are all normal. So ma'am, I can advise to stay hydrated, eat healthy foods, and of course, ma'am, stay safe. And thank you po for your cooperation.
Thank you din po, nurse.
So, thank you po.
Thank you po. Yes!